You're listening to In Good Health, the trusted news source for medicine, science, and technology. I'm Elisabeth Westfield.
I'm Mayan Vasta Betancourt.
And I'm Greg Johnson. This week, how to negotiate your medical bills.
There are so many ways to lower your costs that doing it completely by yourself and paying full price is really shortchanging yourself.
But first, a tool that's giving all cancer patients access to expert care.
You see patients treated at that top center living on average 73% longer than the patient living in the community or rural setting.
All that and more this week on In Good Health.
Each week on the Viewpoints Radio podcast, you'll hear from our leading experts on an important topic within education, history, society, psychology, and more.
As one researcher puts it, nobody waves, but everyone waves back. Once you do offer that initiation and that opportunity, people are more willing to connect with you than you think.
Viewpoints Radio podcast is produced by our team of award-winning journalists. Subscribe today by searching Viewpoints Radio wherever you listen to podcasts.
There are millions of Americans diagnosed with cancer each year, and the last thing they should have to worry about is having their life expectancy shortened because of where they live. Research shows that having access to state-of-the-art cancer centers has a significant impact on survival rates.
If you take a cancer like multiple myeloma, for example, this is a type of rare blood cancer. You compare the survival between being treated somewhere at a Mayo Clinic or a top center compared to your average community clinic. You see patients treated at that top center living on average 73% longer than the patient living in the community or rural setting.
That's Simone Jensen, founder and CEO of Radical Health. Medical knowledge is growing at a rapid pace, with a 2022 paper in Cancer Reports estimating that there is an average of 100,000 cancer-related articles published each year. That's a new study every 5 minutes. And while oncologists at top programs are more able to hyper-specialize, thousands of others have to cover and treat a wide range of cancers.
So, for example, you have to treat breast cancer and colorectal cancer and prostate cancer all at once. Versus if you look at these top centers, the clinicians tend to be very specialized in their unique area. Like they'll only focus on a subset of breast cancer. So there, let's say there's like a new update every single day, they're able to keep on top of that. But for a community oncologist, it's just incredibly difficult when so many things are being published every day to stay up to standard of care across all these types of cancer.
Which means some treatments and care strategies being prescribed are out of date or not as effective as newer options. But Jensen is working to change that with Radical Health. In an effort to give all patients access to top-tier care, Radical Health has trained AI models using the top cancer centers in America. She likens one of Radical's training methods to a cancer-specific form of ChatGPT.
That model has been trained to think exactly like a human doctor would. So it's read every single textbook, every single medical research article. It understands your unique cancer case and can compare it. So that's kind of our reasoning model. We call that like thinking like you're a top oncologist, and we get it to reason through the case step by step. But instead of just having limited context in your brain, we've read every single textbook, every single medical research paper.
For patients, getting an expert breakdown of their specific cancer and care plan is as simple as uploading their medical records onto Radical's platform.
We have the ability to link to 99% of all the providers in the country. So patients come to our website and type in the center they're treated at. So they may type in UCSF or the Mayo Clinic or a local hospital they're being treated at. Then on the back end, we're able to pull that data usually within 10 minutes or so. So then we have access to their entire medical records.
That data gets processed through the trained AI models, which are constantly monitoring the latest research and advancements. The final report is a personalized breakdown of the patient's diagnosis and treatment options.
We'll start by giving them an overview of their cancer, like what is unique about them, and then providing treatment options which could be relevant to them. So maybe they should go down this surgical route or down this immunotherapy route, and allow them to essentially be able to compare their options like they were being treated at a top center. And then we also provide information on the latest research, any clinical trials that would be relevant for them, and then the ability to refer them to those centers.
This information is possible through partnerships with top institutions like the Mayo Clinic and Johns Hopkins, which allow Radical access to millions of cases treated at these facilities.
And this really is the first time this data has ever been shared with anyone before. The Mayo Clinic would love to be able to provide every patient in the country to Mayo level care, MSK level care to every patient in the country. And they realize that the only way they can do that is if they work with an AI company like ourselves and give us their data, and then we can train an AI model, which essentially acts like their top doctors. And then because we're software, it's scalable to every patient in the country.
It's important to know that Radical is HIPAA and SOC 2 compliant. Personal health data is securely stored and can be deleted at the patient's request. Jensen says one of the best parts about having access to real cases from these top institutions is that Radical can find one that's most similar to the user and compare the data.
So let's say a stage 4 colorectal cancer patient comes to us. We can look at their medical record, and then we can go to this huge data set we have, and we can be like, oh, we found that for similar patients at these top centers, drug A is better than drug B because we can see you look very similar to that patient in like a genetic and radiology perspective. So it's both combining all the research ever published online and then also being able to go deeper and then actually personalize care by being able to find out, like, have there been any patients in the past exactly like you and what worked really well for them, and fully individualizing care there.
There's a section included at the bottom of these patient reports that walks users through what questions they should ask their oncologist, which really allows the patients to be an active, educated member of their care team.
Some patients really want a surgery, some patients don't want a surgery, and we essentially provide patients with all the options to be able to make the most informed decision for both themselves and the family as well. So we have a couple of exciting cases where patients were able to actually influence their care journey based on what they actually wanted themselves versus just what was standard of care in healthcare.
And while Radical's reports can help increase advocacy, for some patients, it serves as a confirmation that they're on the right treatment path. Elisabeth Drabkin discovered Radical after her first cancer diagnosis had been successfully treated. As an active, healthy woman in her 30s, Drabkin was shocked to discover that she had adrenocortical carcinoma. It's a rare and aggressive cancer that forms on the adrenal glands.
I had a very, very large tumor. It was about the size of a grapefruit sitting on my left adrenal gland and abutting some other organs. And so the decision was made, and I really didn't even ask questions because we were, again, just grappling with a very unexpected diagnosis. And so when the Hopkins team said, we're doing a surgery, we did a surgery. And so I did go in that July of 2020. I was unable to have anybody go with me. My husband had to tell me goodbye, give me a kiss in a kind of pre-waiting room area. And I didn't see him for almost 2 weeks.
Thankfully, the surgery was successful. Her doctors expected a reoccurrence within the year, but Drabkin remained cancer-free. That is, until 2024. Nearly 4 years after her surgery, tumors were found in and around her lungs. This was when Jensen came across Drabkin's LinkedIn profile and invited her to try Radical.
Candidly, I was a little skeptical. I, at that point, had reached the kind of mythologized 5-year survival rate. And so in this short but long time, I've seen a few startups, things that promised a lot of things in the cancer care world. But I gave Radical a try.
Since 2020, Drabkin has had a large care team at a top-tier cancer center. Radical's report was able to confirm she was on the right path, but a newer tool in the system offered something that could be a bit harder to find: hope. Alice is Radical's newest AI companion that gives users a more interactive experience.
Patients really wanted to be able to talk to us both on like a daily or like an hourly basis if they have questions on their report. So Alice works in a pretty simple way. You link your phone number. You can also access it on the Radical platform, and she'll essentially text you and ask you how you're feeling every day, and is there to support both on like symptom management, like, oh, I'm feeling nauseous, is there any medication I can take? Like, oh, I'm dehydrated, what should I do? But also just to be there for you in a more like holistic way. Obviously, cancer is such a vulnerable experience both for the patient and their family, and we want to be there to support throughout that period. Obviously, being able to provide everyone with like the top treatment is like a big part of it, like that peace of mind that you're on the right care. But there is also so much we can do in between, from like supporting with like family members to how should I tell my children about my cancer, to what should I be eating, how should I be sleeping.
Drabkin turned to Alice when her doctors had run out of answers.
So I'm currently undergoing a treatment called PEF, pulsed electrical field treatment therapy. It's been FDA cleared for a little while, FDA approved for, I think, about a year and a half. It was initially developed for non-small cell lung cancer. My care team at both Hopkins and NYU has been unable to determine if any other adrenal patients have used this treatment, and if so, what the success rate was for it. I recently thought that I might break Alice essentially by asking her about the use of PEF in adrenal cancer patients.
But to Drabkin's surprise, Alice was able to describe the instances of adrenal patients using PEF and the high success rates this population experienced.
To know that there is a high success rate, even it seems like with adrenal patients, when physicians at world-class institutions could not answer that question with confidence, and Alice could, that to me was a clarion moment. And it almost brought me to tears. I was just staggered. And it gave me the confidence to know that we were pursuing what seems to be the correct treatment for me.
Drabkin is still undergoing PEF treatment and is now a member of Radical's Patient Advisory Board. Jensen says Radical's goal is to have patients at the center of everything they do, and the advisory board helps keep patients involved in how each product is built.
So we have a team of 40 patient advisors who work with us to make sure the way we present information is both easy to understand, but also empathetic while still being informative and allowing them to fully advocate for their care. So we really work with them, and they've been so instrumental in essentially building that patient-facing side with us.
One example of this impact is the reading level of each report. Healthcare is complex, and cutting-edge research often includes words many of us would have to look up the definitions for. So to make sure that each patient can understand their file, Jensen says all reports are set at a 6th grade reading level.
And we find that that level is also enough to be able to communicate all the scientific complexities. We also try to communicate it in quite a visually appealing way, and then we group it into different sections. So we don't assume that you know everything about your cancer to begin with. We start by going into the basics of what actually is stage 1 breast cancer? What does stage 1 mean? What does this ER positive genetic test mean before we dive into the complex treatment options? So we both work with patients who have gone through the process, and then also communicate the words in a simple way, and then have the structure of we don't assume you know anything before. We want to be able to be inclusive to all patients, whether they're just being diagnosed or also later stage as well.
The reports are verified by other AI systems as well as humans before they reach the patient.
So far, we actually haven't had the humans make any changes, but I think it's helpful to have that human in the loop still, because it's also nice for patients to be able to talk to a human who has context on their case. So once we publish this report, they get on a call with our team, our nursing support team, who's able to walk them through it, explain what it means, because although we believe that AI is able to, in theory, provide better recommendations, it's always nice to have that human face-to-face interaction.
You can find more information about Radical Health, Simone, Jensen, Elisabeth Drabkin, and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farrah. Our executive producer is Amira Zaveri. I'm Elisabeth Westfield.
Coming up, resources that can help reduce your healthcare costs when In Good Health returns. There are so many unspoken rules of healthcare that not being in the know can seriously affect how you access care, when it's available, and how much it costs. The Patient Advocacy Foundation is one nonprofit working to spread this knowledge, often helping people with problems they weren't even aware of.
We actually say the reason people call us is never the reason people call us. So someone may say, I'm calling because I have a big bill and I just need to find money to pay for it. But then once we start working with them, we figure out they're not on the right insurance plan and they would qualify for all these different benefits, and we can find them transportation to their doctor's appointments. And so we're with them through that whole journey and teaching them how to advocate for themselves and how to apply for the right things.
That's Caitlin Donovan, Senior Director at the Patient Advocate Foundation. Millions of Americans have medical debt and don't realize that there are options that can reduce their expenses and help them strategize payment plans. Donovan says the first mistake many of us make is paying our medical bills right away without checking for mistakes.
So many medical bills have mistakes in them. Oftentimes, even insurance will get something wrong about how much you owe. So the last thing you ever want to do is get a medical bill and pay it right away. Make sure you're checking for mistakes, like against your explanation of benefits. Make sure that they have your basic information correct. Even that generally you should know what your deductible is for your health insurance plan and how close you are to meeting it. Myself, I have 3 kids. So we're a family of 5, and I've more than once had the insurance company come in and with our deductible incorrect and think that we owe more money towards a bill than we actually did. So it's really important to check and know your own plan and make sure you're getting your full coverage benefits.
While checking for mistakes takes time, it can save you a lot of money in the long run. However, there is a limit to how helpful a watchful eye can be. Donovan says she used to be a big proponent of asking for an itemized bill, but that with today's systems, the potential benefits don't often outweigh the time and effort.
I have been with Patient Advocate Foundation for about 13 years. 13 years ago, I used to say, ask for the itemized bill, check to see that everything is correct on it, that you weren't overcharged for X when you should have been charged for Y. However, in the time from then until now, the number of billing codes has doubled. And not only that, you can also amend a billing code. Something may look wrong that isn't, and at this point, there are billing coding professionals, and the likelihood that you'll be able to really drill down and catch something that's wrong may not be worth your time.
But like she mentioned before, Donovan still encourages everyone to check for simple, straightforward mistakes because the chances of finding at least one are high.
About half of all medical bills have mistakes in them, so checking for the obvious is a good place to start. Make sure it's actually your bill. Make sure it's been billed to the right insurance company. Check and see when your explanation of benefits comes in the mail that what the insurance company is saying you owe aligns with what the hospital is actually billing you or the doctor's office.
Basically, take the time to check all of your bills instead of blindly paying because there's a good chance it'll save you money. Not only has research proven this, but it held true when Donovan conducted her own personal experiment.
When I was pregnant with my youngest, I kept a spreadsheet of all the costs associated with that pregnancy, just for fun to see if what we've been saying all along about the number of mistakes and bills would apply to me. And not only did exactly half of my bills have mistakes in them, but if I hadn't caught them, it would have cost me about an extra $2,000.
Donovan says when you catch a mistake, it's often an easy fix by calling the billing office, and the most annoying part is simply being on hold for a bit. However, there are cases that are much more difficult and require unyielding persistence and patience. Donovan had this experience after her 20-week ultrasound appointment. She received a bill for $500, even though she'd already met her deductible. However, when she called her insurance, they informed her that she was mistaken and the bill was correct.
So I did something I almost never do, and this comes full circle to why we always delay before we pay, and that is that I sent a check for about $500 right away. And then the next day, I got another bill for about $500 in the mail. And I call my insurance company again, and they say, oops, we thought that was the one you meant yesterday. So you do owe that one, but the one yesterday you don't have to pay. And I had already paid it. And then that was for a 20-week ultrasound. My son was walking before I got that money back.
It took her more than 25 phone calls and multiple conversations with the billing office and insurance company, both on the line, which weren't always productive.
The billing office would lie to me and say that they had taken care of it, only for a week later for them to say that they hadn't, or that they had talked to someone when they hadn't talked to someone. And when finally it all worked, the conclusion was that my insurance company called me and to say, we want you to know after all this that we finally received the correct bill from them, and we sent them the refund check. So you should be getting a refund from them.
Donovan still had to call the billing office and demand her money back before they finally sent a check.
I like to share that story for a couple of reasons, but the big one is that I do this professionally. I have been with the organization for 13 years. I know the tricks of the trade and the ins and outs and the pitfalls, and yet It still took me that much time and that much maneuvering to get what was actually already mine to begin with. So I am so intent on making sure people know that the help is available for them, because most people don't have any of that context or knowledge.
Another major piece of information that many people don't know about is that the price you owe isn't always the price you have to pay. Donovan says many people unknowingly qualify for financial assistance through their hospital.
A lot of hospitals won't tell you up front that you qualify, so you have to seek out that information yourself. And you should never assume that you won't. A lot of hospitals, I know New York hospitals, that will provide assistance up to incomes in the six figures. So that's out there and it's available. But different hospital systems will qualify you in different ways. For some, you have to live within a certain geographic range even of the hospital. It all depends on what they've set up and what they provide. So, and sometimes how much you make may qualify you for getting a complete 100% wipeout of your entire medical bill, or sometimes it may provide a discount, but that is the absolute best place to start.
After checking if you qualify for financial assistance, you can also look into negotiating your bill. But before calling the billing office, find out how much your care usually costs, what your insurance covers, and how much you're able to afford.
What your goal is to see what a reasonable price would be, including what your insurance has already paid. And then look at what you can afford. Most hospitals will set up some type of payment plan. It is better financially to set that up with them rather than, say, putting $20,000 on a credit card and dealing with those high interest rates. The key is to offer them something and see if you can lower your overall commitment, because ultimately so many times hospitals are going to be worried that they won't get anything out of you. So if you are responsible, if you're responsive, if you're offering something and you're working with them, you have a pretty decent chance of being able to get yourself into a good position for success.
If you find yourself still unable to afford the final amount, there are other out-of-the-box options available. Donovan encourages people to look for other organizations that may be able to ease financial burdens in different aspects of their lives, not just in the medical world.
Say you have a bill because you have a cancer diagnosis and you had surgery in the hospital. Don't just look for cancer funds, although that is a great place to start. There are a lot of cancer funds. Go further than that. Look for financial assistance for cancer patients, for housing, for transportation. I don't know about you, but I don't have a separate bank account for my mortgage and a separate one for my groceries. They're all in the same account. And think about that when you think about what you're pulling in to assist you. If you can free up money that would have gone towards your rent or mortgage and put that towards that medical bill, you're still coming out ahead.
The Patient Advocate Foundation has a national financial resource directory that makes it easy for anyone to find organizations that fit their unique needs.
There are so many ways to lower your costs and so many great organizations out there to help you once that you've negotiated or even once you've landed on a final number, that doing it completely by yourself and paying full price is really shortchanging yourself.
The full list is available at patientadvocate.org/financial. You can also find it and more information about Caitlin Donovan on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farrah. Our production manager is Jason Dickey. I'm Greg Johnson.
In Good Health returns in just a moment.
Medical notes this week. Good news. Your genes don't have the final say when it comes to your brain health. New research shows that controlling risk factors like high blood pressure can significantly lower dementia risk, even for those carrying the high-risk gene variant. So while you can't change your DNA, managing your blood pressure and cardiovascular health provides a powerful, modifiable way to avoid the worst outcomes. The research is published in Annals of Neurology. Too much of a popular supplement could be setting the stage for unexpected birth defects. A study published in Frontiers in Cell and Developmental Biology warns that high doses of common antioxidants, like NAC, can negatively alter sperm DNA. In mouse models, this change led to differences in the offspring's skull and face shape. Even when the father appeared perfectly healthy, his high intake of antioxidants resulted in female offspring with smaller skulls and closer-set eyes. NAC is a key ingredient in many multivitamins, so it's important to pay attention to how much you're ingesting past the recommended daily amount. Where you live might be as important to your health as your DNA. According to a study published in JAMA Health Forum, researchers found large disparities in life expectancy across the world. Despite the U.S. spending the most on healthcare, America continues to lag behind in preventing early deaths. In 1970, we were behind by 29 years, and in 2019, that gap has increased to 38 years. The researchers cite Japan as the place to be for longevity. And finally, the secret to overcoming dehydration might be your fitness level. New research published in Physiology and Behavior suggests that physically fit people may have a buffer that helps the brain and body maintain performance when water is scarce. While staying hydrated remains essential, these findings imply that being in peak shape could be a huge advantage for outdoor workers and athletes facing an increasingly warming world. And that's Medical Notes this week. I'm Mayan Vasta Betancourt.
Thank you for joining us this week and every week as we break down the science stories you need to know. You can find all of our past segments and guests on our website at ingoodhealthpodcast.org or wherever you listen to your podcasts. Follow us on Instagram, Facebook, and X for more behind-the-scenes content. Tune in next week for another edition of In Good Health.